This is the essence of our day together to really listen to what these young folk have to say. And before we uh, selected the students, and even after I asked um, to get all their bios, their sketches, you know, and because I wanted to get a sense of who they are. And when you're in high school, and sometimes when you start college, you really haven't done a whole lot of things you want to put on paper. You've done a whole lot of things, but you don't know what's important and what's not important. So I looked at the bio sketch and thought I'd do it a different way, rather than try to read what the descriptions are. Also, I've learned over time that names are very, very important, and it's nothing more offensive or insulting to say somebody's name wrong. And it doesn't have to do with how it's spelled. It's how it's pronounced. We had a young woman who, uh, when I in the MPH program at Tuskegee several years back, um, really bright, really energetic. Matter of fact, she did her undergraduate studies at Emory and came to Tuskegee to do the MPH degree. And had her name, and I can read and do phonetics pretty good. And her name was Beatrice, easy to pronounce. And so when she came, first met her, he said, "This is Beatrice." That's what I said as I introduced her to people. "This is Beatrice." And first time she didn't say anything. Second time I introduced her, "This is Beatrice." And she kind of looked at me kind of strange. And then the third time, I introduced her to another forum. I said, "This is Beatrice." And she's an MPH student at Tuskegee, and real proud of her. She pulled me aside. She said, "Dr. Warren, in all due respect, I was named after my grandmother, and her name is Beatrice. My name ain't Beatrice. I was named after my grandmama, and her name is Beatrice." So I learned at that point, I ain't trying to pronounce anybody's name anymore. I want you to hear them tell you what their name is so you won't mess up like I did. The other thing that I want them to do is, in saying their full name, I want them to say where they're from. And for many of us, where you're from is different than where you are. For some of us, where you're born and where you're from and where you are changes regularly. So I want them to tell you where they're from and where they are. That is, where I am is the high school, where I am and what level I am. And then lastly, so we won't spend a lot of time talking about them instead of listening to them. Um, the most important thing that you want this audience to know about you, not what I think is important, but what you think is the most important one thing that you want the audience to know about you. And it doesn't really matter what we think. And let me give you an example, because I've learned to listen to my now grown children, and then we'll move on. I think it's important here. I'm a dentist by my primary training, um, and as you notice, I have a diastema. That's what dentists say. That's a gap. That's what for a gap. And my mama had a gap. My dad had a gap, and all most of them, they all had it. So, but when I got in dental school, we were taught that that the the anatomical profile, the appropriate one, um, your teeth are aligned, and there's no diastema. So I'm going to be the studious dental student. He says, no diastomer. And so as my son was coming up and he got to be about 12, we took him to the dentist. And they paid $3,000-4,000 for braces to straighten his teeth out. So it wasn't any gap. It wasn't a diastomer, to say it professionally. And 3 years, and it was all straight. His profile was perfect. And then you get a retainer that you wear for 2 years. That gives the bone a chance to solidify so the teeth won't move again. So I got the retainer, and I'm paying big time money. And I noticed he wasn't wearing the retainer. So, Daddy, I lost it. So I got him another one, and he wasn't wearing the retainer. I said, well, Ali, I paid $5,000 to get you some braces, and they perfect. And what's wrong, bro? You're not wearing your retainer. Your teeth are going. He said, look, man, you got a gap. My grandmama have a gap. My uncles has a gap. I want my gap back. My son is 34, and if you see him, guess what? He's got a gap. I say that to say your identity, who you want them to know who you are, is critically important. It's just not a whole story, just what's the most important thing that you want this audience to know, because that will contextualize what you say. You know what I'm saying? They will understand what you say a lot by who you want them to know, what you want them to know about you. So let me start with my immediate right. And your name, where you're from, where you are, that's your school, your grade, and the most important thing, four things. Now I'm gonna say it again so y'all won't be wondering what you're supposed to do. Your name, got that? Shouldn't be too hard. Where you're from, where you are, that's the school grade, and the last and most, what do you want them to know about you, sir?
Morning, everyone. My name is Adolfo Verdugo, and I was born in Atlanta, Georgia, and I'm currently a senior at Chamblee Charter High School. And what I want you guys to remember me about is that all I want to do is spark change within my Latinx community. I've seen that, within my community, we've been struggling a lot financially and with healthcare, and I just want to make a change for them.
Good morning. My name is Kendarius Ivy. I am a senior at Booker T. Washington High School in Tuskegee, Alabama. And a small thing about me, I'll be attending Tuskegee University in the fall as a sophomore. And I guess that'll be it for the time being.
Hi, I'm Emma McDonald. I'm from Conyers, Georgia, and I'm a sophomore at Rockdale Magnet. And I really don't know what I would want you guys to know about me. I guess I have two older brothers, and I also just want to change things for the better, whether that be environmental or just equality for different people.
Oh, let's see if this one works. Maybe. Okay, hi. My name is Maya Martin. I'm 18 and I'm a sophomore at Agnes Scott College. And we're both from Vox ATL. And one thing I would want you to know about me is that I'm a journalist. I love learning about people and writing and listening to NPR.
Good morning. My name is Jemiah McNeil, and I am from Tuskegee, Alabama. And currently, I'm a senior at Booker T. Washington High School. And I plan on attending Tuskegee University in the fall. And I chose Tuskegee because that's where I want the change to start.
All right, so you have a sense of who you're going to be listening to. What I want to frame this conversation, it is a conversation around the topic areas that the whole day is grounded in and around. We wrestle with these topic areas because there are all kind of things going on in the world, and it's fuzzy. And there weren't, because of the nature of the timing and whatever, there wasn't a lot. We didn't have young folk with us, so we were trying to figure it out. And that's why it took us so long trying to figure it out. And you say, well, when I was in high school, well, that didn't work at all. So what we framed them the best we could. And so as we want you all to respond to these topic areas with just a statement of how you interpret them to read and what that means to you. Uh, and it may mean something very different. That gives us a context from which to have this broader conversation. And we'll do that. And then, most important, as we learned from last year, is the questions that you all have about the folks up here. So we want to at least get some sense of that. So we'll go by the first topic area and then let them say what that means in their context for each of the panelists, and then we can have some conversation about that. So we're going to subset these because they're very important areas as we view them, and you all may view them differently. So why don't we start, since we have a kind of a line already, we'll start to my immediate right. The first topic area is adolescent access to sexual health education and services. And let me start by saying, what is an adolescent? So let's start here with our first panelist, Adolfo. What does this topic area mean? But I also want to hear what you think an adolescent is. And there's no right or wrong answer to this conversation. What do you think an adolescent is?
All right. So for me, what an adolescent is, I guess it's someone that's like, I guess getting into those stages of becoming an adult. And what else?
That's good. Okay, yeah. And what is your thoughts about this first topic area? Adolescent access to sexual health education and services. What does that mean to you? And what we're really trying to get you to say, not what it means to us, what we intended to be. What does that mean to you? When somebody says access to sexual health, education, and health and sexual health services.
So in a sense, I feel that sexual health is something that needs to be addressed. So I mean, I have quite a lot of examples. So from
Hmm.
where I grew up in the city of Dorville, and I've attended Sequoia Middle School, and now Cross Key. And then I went to Cross Keys High School before going to Chambly. And those two schools compared to Chambly are very different. Chambly is very, they get all the funds from the state, so they have a good um, health program within the school. But then there's schools like Sequoia and Cross Keys, and then they don't have that sort of aid from the state. So when I took health in seventh and eighth grade, they didn't really address um, what is it, like sexual health and everything like that. And so I feel like there needs to be, I don't know, some sort of like program for that. I mean, I didn't really get um, so most of my education from that topic would have probably been from like, I don't know, just from experiences from the outside world, like just being with friends and just seeing what other people within my community have done and what pathways they've taken. Um, I could say from firsthand is that their choices weren't the best, and I mean their health hasn't been that well either because of those choices. So I feel like there needs to be some sort of change for those communities in those areas. And I mean, on the other hand, Chambly, it's more of a, I mean, they have more funds, so they're the area of Chambly. So Chambly is quite a big city, and it's divided into two areas. I like to call it the poor area of Chambly and the rich area of Chambly. And my school is mainly in the rich area of Chambly. And I mean, their programs are good too. But you don't see that type of stuff that I've seen in the city of Doraville or in the poor part of Chambly. And that area of Chambly is filled with a lot of Hispanics and a lot of mainly from Guatemala, and they don't really know what that sexual health, like how to have like protective sex or abstinence or anything like that. Like they don't know that those type of stuff. So I really do feel like that we need to address those topics more in areas like Doraville or that one section of Chambly.
Thank you.
Um, being and first, I'm gonna address what I feel an adolescent is. I feel like Adolfo said, an adolescent is just somebody that's coming to those stages of adulthood. As far as adolescent access to sexual health and education, in my community, at my high school, we do have health. We have health class and things of that nature. But in our health class, we don't address sexual health. We don't address sexual health, and it's not looked at as much as it should be. For especially being adolescents, you get curious. Stuff like it happens. Don't can't even gloss over. It happens. So for us to not address it the way that address it as much as it should be, it was a detriment to young people, and that's just point blank. To saying it, I I just can say that it needs to be addressed more. It's too many kids fall victim to not being apprised of how important it is to be knowledgeable of it. To be ignorant of it is it hurts you more than it helps. A lot of older people think that if you don't know, you won't try. No, that's not how it works. So, like, as older people, I would ask that let your kids know.
So going back to the definition of an adolescent thing, yeah, I really just think it's someone who's still like learning how to kind of stand on their own 2 feet and like growing into themselves as a person. There's not really like a set age range because it really does change from person to person, like how fast that person matures. And then about the topic, I know that I haven't had like a real health class since 6th grade, and of course they didn't talk about anything relating to that. It was mostly just about like drug and alcohol prevention stuff. And then when you get into high school, like it's required that you take a health class, but really we're focused on going through and becoming like competitive enough for the college admissions process. So it's like I took health online and I took physical education online over my summers. That way I could take more APs. So that way I could like get into college. And of course, over that, like there you would think that if there's not that like awkwardness in the room of trying to address it, then like they would put something in there like a PowerPoint you have to look at or something. But there wasn't. Like, and if the system is like going through and it's like this lacking trying to educate like heterosexual youth on this, then you know that it's even more lacking for LGBTQ youth, and they're like not getting the different information that they need about having safe sex or anything like that. And then heterosexual youth aren't learning about family planning or different options they have and different ways to go through and set up their life for success. That way they can get to where they want to be before they make like the knowledgeable decision of what they want to do. Yeah.
So I went to a very small conservative high school, and I think that we learned about abstinence was definitely encouraged, and it was very like heterocentric, and yeah, so I think that a comprehensive sexual health plan would include all kinds of relationships, including LGBTQ plus, and not just abstinence, but how to have safe sex. Because like you said, people are going to do these things anyway, and it's just like best to know and how to like to know overall sexual health because it's part of like who you are as a person overall. Um, and I think like it also includes having access to HIV testing, condoms, and birth control, like without parental permission, because like even if you're doing these things, you need to be have an avenue to do it safely without like your parents knowing, because you're not going to reach out if you have to go through your parents. Um, so yeah, most of what I learned about like sexual health was through the internet, and I think it should not be that way.
Okay, I agree with all of them, but I feel like sexual education should be taught in well, not all schools, like middle school and up, because all the students, like, they know exactly what they want and what they're going to do. And the way that we're being raised now, I feel like we're growing up faster than everyone else did. So at my middle school, we used to learn about sexual education with um, we had a coach. His name was Coach Patrick, and he used to teach us about all types of diseases and um, I forgot everything else he said, but that was in like seventh grade. But he taught us a lot. We used to take a lot of tests, but it was very anonymous, so he wouldn't know who. He would just know like what we're doing. And I feel like every middle school should have that, just to like show the students what they need, because they won't talk to their parents unless it's like life or death. So that's how I feel about it.
You know what? You have a sense of what they think. And rather than let you ask them questions now, because we'll be the whole day on this one subject, I want to do the same thing with all this topic area. So just jot down your questions so we can get through at least the subject areas that we thought were important. So you have a sense of where they're coming from with that. So we'll come back to that. But the second uh, topic area, facing substance abuse and mental health challenges with facts and moral courage. Facing substance abuse and mental health challenges with facts and moral courage. Panel, what does that mean to you?
So, like I said before, I was raised in a small city that's filled with a lot of minorities, and substance abuse was something that was, well, not really now, but growing up in my elementary school days was something that was common. And um, I mean, in that area, like, people wouldn't say anything. It would be adults doing it, kids doing it. Like, I'd be outside on the soccer field playing, and then you'd see other people, I mean, doing drugs and all that stuff. And I mean, to me, it was just common in my area. And why they did those stuff, and I really don't know why. Um, I guess it's just because everyone that in that area did it. People would just follow that path, like, oh, hey, I'm gonna do it too, and it just continues on and on. And now that sort of substance abuse, I don't really see it that much in my area. But I mean, it's still present, but it's not as high as it was before. But I mean, mentally, it didn't really affect me because, well, me personally, because I really didn't care about that type of stuff. Like, my parents kept me going on the right path, which I'm thankful for that. But there are I've had friends and even family members that went down that path of substance abuse. And I don't know, I feel like in those areas where there are a lot of minorities, it's just not, there aren't any programs or organizations present to sort of get them aware that this isn't the way to go and stuff like that.
Okay, substance abuse is quite honestly in this climate, like now, it's become really normalized, and it's not okay. Um, if I had to put a thing on it, I honestly say that it's like media, pop culture thing. People don't know how to differentiate between reality and what they see. So it's like a lot of younger people, especially marijuana. Young people smoke. Young people smoke marijuana, and like a lot of people say that it's okay. It came from the ground, came from the earth, and ain't gonna hurt nobody. But still, like, it's not it gotta be something. Come on, something gotta happen because it's not okay. People don't have the young people, especially, don't have the. I don't want to say don't have the maturity. I don't want to say they don't have the maturity, but we think we do, and we don't at times, and we don't a lot of the time. And it's just we should be able. Somebody should be there to let us know, not to like nag and like talk down, but to let us know that we do have limits. A lot of as young people, we don't see that we have limits, but we have limits. And I just feel as if to look at substance abuse, be it over the counter medication, be it drugs, be it alcohol, be it whatever. We should be able to look at it with clarity, look at it for what it is, take it at face value, and just know that it's not for us. And that's just my little look on it from Plainview.
All right, so I'm gonna go through and I'm gonna like go into like my personal experiences with my life with this. So my oldest brother, he's 5 years older than me. When he was in high school, he was diagnosed with bipolar depression and anxiety. And before he was able to have access to the right medication, he went and he turned to substance abuse, whether that be alcohol or smoking and lots of other things. And it, that kind of stuff affects people differently. But for him, it wasn't good. And he got into some trouble with when he was going through and he was using those substances. And it really messed up his life for a while. And that was really hard for all of us. It was hard. Like at home when he was going through and he was suffering with that, and when he was in and out of different facilities trying to get help. But I think that if we went through and we tried to like destigmatize mental illness, if people knew that it was okay to reach out and ask for help like earlier before it got to that breaking point, then people would be able to get access to the like legal and safe medications they needed. That way they wouldn't feel that way and they wouldn't have to turn to these different substances to try and help themselves. And it would just be a lot easier. So I think that we need to open up that conversation. That way people are okay with like going and reaching out for help before it gets to a point where it's going to ruin their lives and hurt the people around them.
Yeah, thank you for sharing that. So I think that we should treat people who struggle with substance abuse with compassion, and treat it as a disease instead of a lifestyle choice. And I think that sending kids to jail for doing drugs is not the answer.
Substance abuse is very common in Tuskegee, Alabama. So I see it mostly every day. And I feel like it's very common because the students and everyone else, they're able to get access to these drugs like so easily. So, and I feel like we have a lot of problems because we don't know how to talk about our problems. Like we don't know how to handle it. So we turn to drugs and alcohol and everything. So everyone mostly in my school, they mostly smoke weed. And it's not good at all, but it's easy access and they feel like it's a sense of peace and calm. So, mm.
Thinking about that very sensitive and I think an important topic, how does how what are the intergenerational challenges? Looking at your parents and other folks, how are those intergenerational challenges, those structures, um, impact upon substance abuse and the diversity of your population of young folk? Are adults helpful? They're not helpful? What are the challenges that you see with what we call intergenerational structural challenges around substance abuse?
All right, so so for me, I guess from what I've seen, the older generation mm, hasn't really helped out. I mean, because like I said before, most of the people in my area are Hispanic, and they tend to have that mentality of back in the day, like in Mexico or in Guatemala, which is, I mean, once you hit the age of 5, go out there and work on the fields, go cut the maize, collect the coffee beans and all that. And coming to the U.S. because of poverty in those areas, they have that mentality of, oh, hey, you're 5, you're old enough to do this, you're old enough to do that. And I mean, most of the time, most of the kids growing up from parents with these mentalities, they just end up raising themselves in a sense. So, and I mean, most of these kids um, have fallen in substance abuse, and it's mainly due to either because their friends have told them to, hey, try this, or just because they felt lonely out there and they didn't have anyone to talk to. Because, like I said, before, their parents think they're like, they have that mentality of Guatemala or in Mexico or any other area, and they just don't have anyone to talk to. Like the parents are out there working just to get enough money for the rent and for food. And I don't know, because of from what I've seen, that's why I think that the older generation hasn't really helped out.
In my case, I was raised the first few years of my life with my grandparents, and my grandparents, they didn't like, they talked to me. So I never wanted to get any closer substances of any nature, and like they would always talk to me, even if I did. Like they tell me, they lay it down, and like I remember when I went to my first party, my granddaddy said, don't get drunk. People take advantage of you. So I don't drink. I don't smoke. So it's just like a lot of people don't have that support system. A lot of people don't have somebody in their ear telling them the way, if they do something, do it in a way that don't put them in that doesn't put them in danger. A lot of people don't have that. A lot of people, so that older generation, a lot of people don't have that older generation that got some sense to tell them what to do and what not to do, or how to do it if they do it. So it's like a lot of people don't feel that positive hold on them. A lot of people don't have it, and when they don't have it, they are victim of circumstance at that point. And if they have a hold and it's not positive, it's even worse, because now they're being pushed towards doing something that's not helping them at all. And it defeats the purpose. If you're not contributing, you're taking away. So you're not helping anyone. You're not doing anything worthwhile. You're just holding them back. And that's what the older generation does for some of the people that I see around Booker T. Washington High School. But thankfully, we have a support system at Booker T. Washington High School now named Belinda Copeland Sutherland, who is actually there for students, but it's up to the students to go to her. She leaves her door open, but it's up to them to go to her. And that's just it.
I think that this kind of like goes back to what we were talking about originally, where it's like if you just tell kids not to do something with no explanation, they're not gonna listen. If you're just like, don't have sex, it's like, okay. Don't do drugs, like, all right. And then like you have to actually have a conversation about why these things are important and the different effects it can have. Because it's like, I know kids, they'll go and they'll be like smoking weed, and then it's Red Ribbon Week, and they're like, I promise to be drug-free, guys. Like, look at this. And they're going and they're like posting with their little like backgrounds and stuff that they set up around the school. But it's like people aren't taking it seriously because they haven't been told about the serious consequences that these kinds of things can have. It's just don't do it, and that's the end of the conversation. But really, you need to understand what you're doing. You need to be knowledgeable and be able to make those decisions for yourself. And I think that adults are responsible for going through and providing that information to the youth so that way they can make those knowledgeable and conscious decisions on their own.
So I can't really speak to this because I don't have experience with substance abuse or in my immediate family, but I would just echo Kendarius and Emma that a support system of people saying, like, just grounding you in who you are before you go off to college is especially important, and like educating people about the effects of these drugs.
I feel like it depends on who you were raised by, like if you were raised by your mom or your dad or both. And I feel like it depends on who you surround yourself with and your friends, like in your friend group, because they have a really big impact on what you're going to do or what you decide to do. And that's all.
In different communities around the country, and even within communities, we have a challenge with accessing fresh fruits and vegetables. Um, Sometimes you can get them, but you don't want them. And sometimes you want them and can't get them. Have you had any experience with getting access to, fresh fruits versus going to the store and buying um, Pepsi or Coke or whatever? Or is that an issue for you? Is that an issue, getting the right kind of food that you think you should be having in your community?
I mean, personally, I haven't experienced anything like not having access to fresh fruits or vegetables. I live like right next to a farmer's market, so whenever we need something, I just go run quickly and grab something real quick. But I have friends that have. It's been hard for them to get access to them, and mainly because they don't have a like the other parent, like they're either missing a dad or a mom, and it's kind of hard for them finding food. So, and one of my neighbors, he's a junior at my school, and we've been good friends for quite a while now, and he's a sort of an inspiration to me for what he's doing because he's working hard in engineering. But the thing with him is that so he's grown up without a father, and food has been kind of a struggle for him. Like his mom works at a cleaning hotels, so whenever in hotels when they don't have like I guess extra food that they don't use, like she just grabs it and takes him home. And take note of this that she's also raising 5 kids, so it's hard trying to feed 5 boys every single day. So for them, access to food has been pretty hard, and I don't know. I've helped him out a bit with food and all that, but I mean, from what I've seen, it's pretty hard just trying to get fresh fruits and fresh vegetables every single day. And I could imagine the struggle that the mom goes every single day, working from 7 a.m., coming home at 9 p.m., barely seeing her children, and she doesn't even know at times if they eat or if they don't eat. Um, but I mean, she comes in with food from the hotel, but I mean, sometimes it's not even like I don't want to say it's not good food, but it's not like the most healthiest options of food, and I feel like it's something that needs to change within that area.
In my community, at the high school, we had a vegetable garden at the high school, but it got a little rough. But thanks to the way I was raised, my grandparents, we grow all our, well, I ain't gonna say all our food, but we greens, okra, peppers, we grow a lot of stuff. So when I want something to eat, I go to grandma's house because mama don't feel like cooking every day. But in Tuskegee as a whole, it's really hard to get fresh fruits and vegetables. Cause you go in Piggly Wiggly and the vegetables and the fruits in Piggly Wiggly, just being honest, they don't look attractive. People look at the way the food look. It don't look attractive. It don't make you want to eat it. And I just think that food, you shouldn't have. You're not gonna get anybody to eat healthy by having food that don't look healthy to eat. And with McDonald's on this corner, American Deli right down the street, and churches and Burger King right across from each other, something not gonna happen. So it's just the access to fresh fruits and vegetables in Tuskegee is not. It's not. Yeah. It's not conducive to being healthy. It's not conducive to living a healthy lifestyle. It's getting better. It's honestly getting better. We're getting the vegetable garden back up and running at BTW thanks to 4-H and the students on campus at Tuskegee University. But it could be a lot better. But it's gonna get there.
So in Rockdale, it's not really about like whether or not it's like there are fresh fruits and vegetables at the stores and stuff, but as everyone knows, like going through and trying to purchase healthier foods is always way more expensive than being able to just like go to different fast food places. And people can be like, oh, but it's really not if you go through and you get these foods and you like meal prep and then you're like fed for a week. And it's like, but it takes a lot of money to be able to originally get that. And if you don't have that big sum of money to begin with, then you can't do that. So sometimes it ends up being like more expensive when you don't have that money originally, even though like if you had that all at once, then it would be able to work out. And then I'm going to go on another tangent just about like access to different healthy foods and stuff. I know that in Rockdale we go through and we have programs so that way students can come to certain locations over breaks or over the summer to be able to get food. But I don't know who goes through and provides that food, but I know that a lot of the time, especially recently, we've been getting a lot of like negative media around our different like food options that we have. I know that at one of the high schools, it was like a month or two ago, we went through and we were in the news for having like raw chicken stuff. And then people are going through and there's like videos circulating of all these different like spoiled drinks that people are pouring out. And just we've had 2 elementary schools shut down within the previous year because there's been an outbreak of like norovirus. So it's like there's a lot of stuff going on in these kitchens that's not providing healthy food. And if this is what we're going through and we're like bringing to these people when they don't have access to that at school, then it's like we're just going through and we're feeding into that like unhealthy lifestyle for these people that are like trapped in a cycle of poverty. I think that we need to do a better job of like going through and giving people these like resources to healthy food. That way they can go through and actually like focus on their studies or what they want to do and be able to like better that and break that cycle and get out of it and provide a better life for their kids.
So I live in Lithonia, and we have a few grocery stores. I think my mom puts in like the extra effort to buy fruits and vegetables, but I know that's like not a choice for everyone because there are food deserts that exist, and college is especially a difficult time. Especially if you're not on the meal plan of the college that you go to. If you don't have a car, then you would have to walk like 4 miles to go to get fresh fruits and vegetables, and it's so much easier to just like go to some place and buy Doritos. Um, so yeah, I think that's like an especially hard time as well.
Personally, I don't feel like any grocery stores in Tuskegee is good. I used to work at Piggly Wiggly, and I feel like that place was terrible and nasty. Like it was gnats flying around, like all of the fruit. I don't know who would buy it, but some people did because that's the only option they had. But I feel like it should be way better. We shouldn't have to go to Walmart or any store in Auburn to buy our food, but we have to.
Now, the last question, and then we can have some really dialogue. I asked you early on about what does being an adolescent mean? What does that mean to you? And you know, right now there's some rules, regulations about taking certain vaccines. Everybody's supposed to get a flu shot and other things. In certain schools, you can't go to without getting your vaccines up to date. Who should you be responsible for deciding that? If you want to get a flu shot or don't want to get a flu shot, what do you think?
Yeah, I feel like the individual has the right to choose if they want the flu shot or if they don't. Like, um, I'll use myself as an example. I have 2 other little siblings, and the 3 of us, we go when it's like flu season, we go to the doctor and get our flu shots. But my parents, they don't get flu shots. Well, number one, it's kind of well, it's not that expensive for them, but I guess they just don't want to pay for it. And also, I feel like their immune system is pretty good too because of the way they've grown up. They grew up in Guatemala in Cibinal San Marcos, and in that area, it's filled with poverty. And most of the time, they've lived out there in the outdoors, and so they've seen like they've contracted almost I don't want to say everything, but they've contracted quite a few deadly diseases and they've survived it. Like my mom says, just get a few penicillin and you'll be good, is what she said. um, but yeah, that's how. I mean, that's the way they grew up, and um, they've also grown up with a lot of home remedies. So I feel like their immune system is built up, and I guess that's the reason why my mom and my dad don't get flu shots. But when it comes to us, they tell us like every single year, like, "Yo, go get your flu shot, go get your flu shot," this and that. Because I don't know. I guess they feel like just because we didn't grow up in the area that they did, they feel like that we need to get the flu shot. And I mean, in a sense, I feel for me, I don't want to say that I like getting a flu shot, but I mean, it's something that needs to happen because I mean, the flu's like it could turn into something deadly. So yeah.
Um, I always my thing. Um, I don't like the idea of putting somebody else at risk. So I get my flu shot just to be safe. That's just how I roll. I don't like the idea of being the person that got somebody else is sick or hurt because I'm not together. So like, and then at the same time, I want to be together too. I don't want to fall out. So I'm gonna get my flu shot. Cause that's just what I think should be the that's just what I think should be the standard. I guess I don't know.
When you're talking particularly about like flu shots, then I think it's a decision. But if you're going through and you're talking about different vaccines that like you go and you like give children at a young age, like before they go to school and stuff, I think that there should be certain things that you like have to have before you go to school. That way, like if there's an outbreak of something, then like it doesn't go through and just completely like get all these kids sick and like hurt them, like, you know, all that. But I also think that if some people have certain reasons why they don't want to, if it's like a religious reason or just like something that's like medical, then they should be able to have the opportunity to be able to go around that through like a certain system that's been in place. But I think that that needs to be like monitored so that way people aren't just like, oh yeah, I'm a part of this thing, so I don't want to do it. But really, it's like, oh, I'm gonna feed my kid basil and they're gonna be okay. It's like, I just think that we should go through and we should have like it. We should try and ensure the maximum protection for our kids, especially in the school system you're going through and you're like putting hundreds, thousands of kids all in the same place like every day. And it's like these people are interacting. My school is one hallway. We pass by each other every time classes change, and so it's really easy for stuff to spread. So I think we should try and, you know, crack down on that a little bit.
I mean, I haven't gotten the flu shot this year, partly because it's painful, but and also it takes time. So I think like I would want some education like for everyone about why it's very important to take the flu shot in particular, and yeah, just like why is it important? Education important.
I feel like we should have the right to say whether or not we want to get a shot once we become a certain age. But me personally, I don't get flu shots because every time I got them, I would get the flu. So my mom told my doctors every year that I was not going to get it. My sister too, we never get them.
I use the flu shot because it's still fuzzy to some people. Uh, the science is there, but it's still fuzzy to some people. You all have heard what they think about the day. That's what we struggle with for months to figure out the topics, and they clearly have an opinion about it, and they're entitled to. You know where they're coming from. Now they need to know where you're coming from. So we're open to address your question to any one of our panelists or to the whole group, so we can really have a kind of exchange, and we can both learn. Questions, thoughts. Okay, let's start back with Dr. Barrett.
I wonder if you would just talk a bit about what has driven you to be sort of active and, thinking about how to improve your community. I think back when I was in junior high school and I wasn't thinking about how I'm going to get out there and change the community. So I'm wondering how can we get more young people and even adults to be thinking more outside of themselves, so they're not just focusing on what's good for me, but how they can help others.
Do I have the question clear?
Um, as for why I decided to get active, I think back to I can't remember who said it. I want to say it was John F. Kennedy that said, "Think not what your country can do for you, but what you can do for your country." That was something because I want to serve, and but before I serve, I want to be able to leave where I came from in a better place than I left it. I want to be able to look back and be able to say, "Hey, I did all right." And but as far as getting other people to get up and move, my thought process is when you once you see somebody that did well for you and they're doing well for themselves later, people get it together. That was my thing. I saw my mentor Daniel Sutherland. He's the 4-H extension agent for our region, and he does a lot of stuff for the school system between Macon and Bullitt County. And I see the stuff that he does for. He's the one that got the vegetable garden together. He's the one that does community service around the school. He is in charge of the Halloween harvest that they have during in October for Halloween, where the kids come out to the football field and pass out the candy and stuff of that nature. And I just think that young people get active when they see other people getting active, especially other young people, and they see it's going well and they see that it's achieving something, that's when people start to lend a hand. There we go.
Um, so I see it as an accomplishment partly to be able to stand up and do all these things for my community, but I also see it as a privilege because if your parents are absent and you're like supporting all of your siblings, or if you have to work every afternoon after high school, then you're not going to be able to do all these programs. And so I see it as a privilege, and I've had a lot of conversations with my mom about this. That like when she was in high school and college, she had a very different experience just because she would have to work instead of like being able to do all these internships, unpaid opportunities. And so for me to now have this opportunity to do these different programs and climb in my career and learn, I feel like a certain duty to give back. Yeah.
So much is given.
I think that really the first step to going through and like creating a better world is to care about and like try and stand up for issues that don't directly affect you. Because it's like if you're going through and you're struggling with something, then I want to be able to help you. That way you can like get on the same level. And then if I'm going through and I'm struggling with something that doesn't directly affect you, I know that you're going to like reach out and help me back. That way we can all like rise up together. And I think that this generation in particular, you know, we're exposed to so much more. We have like constant updates on everything that's going wrong, not only in the US, but just in the world overall. And so I think that we have a lot of different opportunities. And maybe I just am surrounded by good company, but I know that a lot of my friends, both at Vox, the program that we're part of, and at my school, like all my friends want to go through and they want to make a change. They want to make the world better. And it's just like, I think that going through and providing opportunities like this are really important. And the first step to doing that, like we started off saying, this hasn't always been around. And I think that this is one of the first steps to going through and making a real change. So I appreciate that.
Next question. In the back to my right.
Hi. Do you guys think that minors should be allowed to go?
Let us know who you are so we
Oh,
can.
sure.
Yeah.
My name's Alex. I'm from Chicago, Illinois. I was wondering if you guys think it would be okay or ethically okay for a minor to go and get a vaccine or a flu shot without their parents' permission. I guess it's a question of personal freedom versus public safety, or because I mean, if you're a 16-year-old, you can't go and get a vaccine, or a doctor can't legally give you a vaccine without a parent's permission, correct? So
I don't really have an explanation for this. I'm just going to say yes if, like, you know, it's your body. If you think I want to, you know, not be a danger to others, then I think you should definitely have that right.
I say no because you don't know what you're putting inside of your body if you're not looking into it. Your parents might know something that you don't know.
I would also say yes because you should have autonomy over your own body, even if you're 16. Yeah.
I'm a little indifferent. um, I say I'm a little in the middle, but I'm kind of sort of leaning towards no too. But at the same time, I know that there are people out there that are like against vaccines for whatever reason. And I know I recently read a story about this lady that sued her son because he went and got a vaccine without letting her know. And I don't know, it's weird. So I'm not gonna say I have an opinion or I don't have an opinion. I'm just gonna say I'm somewhere in the middle. But I'm leaning towards no.
I mean, I'd say yes too. Like we have the right to, I mean, to go get vaccines and I guess protect ourselves from other diseases that could potentially be deadly towards us.
Next question, Dr. Hodge.
Good morning, everyone,
Good morning.
and thank you, young people, for absolutely brilliant responses because you tend to highlight somewhere, even if it's between you, the the most important features of what you defend. I, Miss McDonald, I absolutely love that statement you said about defending causes that may not directly relate to you, but the fact that it affects somebody else, then is a cause worth defending. Um, The question I have is on the drug substance abuse question, and this is probably to the Tuskegee person, Mr. Ivy and Miss McNeil, and that is one would think that the small town of Tuskegee that there's limited supply of drugs and substances to abuse, but the way you refer to it is like you see it on a regular basis. Is there how does that occur in such a small town? Is there a pipeline between Atlanta and Montgomery?
All right. So the way I have seen it, I don't want to say undesirables. I really hate saying that, but there are undesirables around Tuskegee that just they add to that. I don't like saying that because it paints this picture that's not positive at all. But there are young people around Tuskegee, especially in the school. They're not a part of that. They're not. I don't. I don't feel like they want to contribute to making Tuskegee a positive place. So they add to the negativity. They add to that air, that negative reputation that some people see that Tuskegee has. So I don't want to use names. But we recently had a young man at Booker T. Washington High School that did that he tried to give. He was caught in the hallways. He was caught in the hallway smoking, and it was just like the big question was why and how. Like, where'd you get it? How did it get here? Because this young man wasn't one of those students. So like, what happened in between you getting to school and you smoking that got it in your hands? And that has always been a big question because BCW not a place like that. That's not a place where things like that happen. So to address your question, I don't want to say that there is a pipeline that something like I don't want to say that people. I don't want to say that it's just like it's just that it does happen a lot, not on a daily basis, but it happens a lot, way more than it should. And I don't like bringing a problem out there, but without providing a solution. But I don't have a solution for it, and that bothers me. But I don't know. Mm, that's a dilemma. We're gonna talk about that later.
Um, I didn't go. Okay. Well, honestly, I kind of forgot your question because Kendarius just took me over.
Oh, okay. Let me reiterate the question, but also let me say to you that that statement you made about that sometimes that we only go to parents with life or death issues, that was very impacting, and it seems that there's kind of divorce in the dialogue between parent and young people, and I'm concerned about that. But the question asked was, um, in a small town like Tuskegee, one might think that there is no drug activity at all. You know, it's not
Mhm.
like you're inner city clamoring for space. You have a lot of open spaces. Like, so how is it the case, or why do you think it is the case that there is such, if not an abundant supply, there is an accessible supply of substances to abuse?
I feel like since Tuskegee is a small town, people would really overlook it. They wouldn't expect it. So Tuskegee, mostly like the students, they mostly smoke weed. So it's like their parents allow them to, so they think it's okay. So they're gonna continue to do it unless their parents stop them. And the statement I said about the parents with the life or death situation, students, we will not tell, like, if you're depressed, if you're going through something, you will not tell your parents unless it's like something hurting you physically, probably. But you never know what you're getting yourself into. But mentally, when problems happen, you're not going to tell your parents because you don't want them to look at you differently or judge you.
Yes, ma'am.
Okay. Hi. We've received a few questions to the OMHHE mailbox. So the first question is from Marco Salas, who's a student at Chattahoochee County High School. And he wants to know, do you think social media is inflicting or making our stress rise? As us high school kids, does it affect our health just being on social media?
Oh, snap. Okay. I would say yes because social media, you're looking at it from a different point of view. You're trying to make your life like that. Like everyone has their expectations on social media, and I'll use Facebook as an example. Facebook is like they have these quotes on there, and it just looks all great and happy, but it's like that's what you want your life to look like. And I don't feel like that's right. I feel like we should have our own mind. We shouldn't be looking towards social media for a life. Like we should have our own. And I feel like every student or everyone should think about deleting everything like social media and trying to find their self. That's all.
Uh, I'd say it's a big yes. It does contribute to stress. I mean, most of adolescents now we tend to care about what other people say about us or on the internet, or we tend to care on how good we look on these social media platforms, and we care more about that stuff and not other things that are going around the world right now. And when we care about things that are going on in social media, I don't know, it brings more stress towards us because we worry about, oh, hey, what this person say or what this person say, or how many likes did I get, this and that. And we tend to forget what reality is like when we're on social media.
So I think social media gives us unhealthy standards to look up to because everyone is posting like the most positive things that are happening in their lives instead of like the negative. But I also don't think that we can just do away with social media forever. Like it's here and it's a part of our lives and it's something that many people enjoy and use like on a daily basis in the teen population. And I think there's tools for using social media. And so what I do is like I follow a bunch of like mental health and positivity accounts, and I also have like an app off timer that limits my time to like 30 minutes per day. And so yeah, that's what I do.
I just think that, everything, like too much of anything is a bad thing. Really, everything can be like positive in moderation. But going through and having, like everyone else said, going through and having these unrealistic expectations because everyone's going through and putting the best of themselves online. That way people will be like, wow. But also, like I was talking about before, this generation has access to a lot more information than any previous generation has had before. So we're also going through and we're getting constant news updates about there's a school shooting, this child was killed due to police brutality, all of these different things. So I think that that definitely takes a toll as well and contributes to the higher rates of mental illness in our generation, which once again brings us back to why we need to open up that conversation between youth and adults. So I'm coming full circle here.
Social media, yeah, it's a big detriment to health. Like she said, it also has its positive. It also contributes to a positive look on life too. But social media, yeah, it hurts. It hurts a lot. It hurts a lot with young people because, like I said, for young people, a lot of young people don't know how to differentiate what they see, but they don't really know how to differentiate entertainment with reality, and it becomes a problem. A lot of people spend too much time on it. I deleted my Facebook at the start of, like, I want to say April. I deleted Facebook because, like, okay, crunch time. I spent too much time on it. Apple tell you how much time you spend on every app, and I was spending. I feel like 45 minutes way too much time to spend on one thing. So like I had to get rid of it. I was spending too much time on it. I started to get fat, so I had to go back to doing. I had to get back into my setting. I had to get myself back where I was before. So I feel like social media, it does mess with you a little bit. It messes with the way you read, with the way you look on life, and it messes with how you live your life. But it just depends on who you are as a person, whether or not you can compartmentalize what's important, where you can prioritize what's important, what doesn't belong. And if you can, go for it. But if you can't, get rid of it. And that's just it. Individual responsibility. That's the key to success.
Question at the mic.
Morning. Thank you again for sharing your stories. My name is Khalifa Wright. I'm a fellow here at the CDC. And just going back to talk a little bit about sexual reproductive health and who you feel you either can or cannot talk to. Do you think you can speak with your health providers about sexual health or just your whatever you're going through in general? And if so, why? And if not, what do you think health providers can do to make that space more open for you to feel comfortable?
I'm gonna say yeah. I mean, not yeah. I'm sorry. I'm gonna say yes, because basically that's what my folks paid them for. So I'm gonna say yeah. I mean, if you're my doctor, I should be able to talk to you. I should be able to ask you questions. If I'm like curious about something, I should be able to ask you a question. If I need a little bit more knowledge on something, I should be able to ask you a question. Because if I put it in Google, it's gonna tell me that I'm dead already. So I need to be able to ask you. Okay, I just need to be able to ask you stuff. So like that's just it. All right.
I'm gonna say no. I don't. Well, the doctors, it's like I feel uncomfortable. I don't know why I would feel uncomfortable, but it's just like first it's like really cold in the doctor's office. You can't really talk because they have a nurse in there too, probably. And then it's like sometimes I have a doctor and she's like I don't know, I don't want to say it like that, but she kind of looks like a man, kind of, and it's like it gives me bad vibes. Like it feels like she's looking at me in a different way. I don't like it though.
Yes, sir.
Do y'all agree that it is harder to grow up in this generation and time period than generations before, like due to social media and all the things that are happening in the world?
Get your name before so we can get.
Oh, my name is Cameron Mackins. I'm a freshman at Tuskegee University.
I feel as if every generation has their problems with growing up. I don't want to say that it's any harder growing up now than it was before because every generation had their problems. My granddad tell me all the time how he had to walk 12 miles to school, and And I'm not gonna say that we know that the high school is only 5 miles away, but it's just it's just every generation has their problems. So like I'm not gonna step over anybody's head and make anybody problems seem like they're not as big as they are, because everybody got their problems. Everybody deal with their problems differently. Um, yeah, that's it.
Yeah, I agree with him. I wouldn't say that it's harder, but I definitely think that it's like different things that are giving us problems. And so I don't think that adults can be like, "Well, I had to do this so you can do it." And it's like, this is a completely different situation. Will you please listen to what I'm saying? So, yeah, I really just think that I'm not going to say it's harder, but I think that it's definitely different struggles that we're dealing with.
I feel like it was harder back then versus now, but it's harder now educational wise. Like we have to have a degree for certain things, and you can't get far with just a bachelor's degree probably. Like you have to have a master's or a doctor's degree in order to do better. But back then it only took one.
Somebody at the mic?
Yeah, go ahead. Let Captain Wilkins. You can speak first. Okay. I'm Malika Washington. I work in the Division of Adolescent and School Health here at CDC. Our division director will be here later this afternoon. But I had a couple of follow-up questions that I wanted to ask after both Alex and Khalifa's questions. The first was around immunizations and just trying to figure out. I know two of you all said that you don't quite feel comfortable making that decision. I wanted to know at what age you felt it was appropriate to be able to make that decision. I know people have commented also on my dress. I just came back from Uganda, which is a neighboring country to the DRC, Democratic Republic of Congo, where they're having a Ebola outbreak, right? So we now have a vaccine there, and daily we were getting reports in on the number of cases, a lot of whom were young adolescent and babies who had contracted Ebola in the Congo, and some of whom died. And so we are seeing that, parents are obviously making their own decisions on their child's health, and this is a different country and all of that. But it made me wonder at what age, you all might even feel comfortable making decisions around immunizations. There were adolescents whose parents refused the vaccination on their behalf, and then subsequently they were removed from the Ebola treatment units and left to go home to home remedies. And so I just wonder what your take was. And of course we are seeing the measles vaccination being refused here, and kids spreading it as well. So just wonder your thoughts on the age that was appropriate to make those decisions, for those of you who said no, and even for those of you who said yes, at what age you really feel that decision should be made. My second question to follow up with Khalifa's was just around, we have a parent child, like a doctor child brief that Dash put out, that says that parents should allow kids time alone with their doctors to have those confidential conversations around reproductive health specifically. So I know some of you are saying that you don't feel comfortable with your provider. And it just, again, made me wonder, well, is that really what we should, say is the best thing to do, to have that confidential conversation so you don't feel uncomfortable with your parents present, to have those discussions with your providers. So the first question is around immunizations and the age that you can consent for immunizations. And then, do you feel that it's appropriate to have time alone with your provider to have those reproductive health conversations?
For the first question, I said no, and I feel like you should be at least 17 or 18. But if you're younger, I feel like you should be able to talk to your parents and tell them that you want it, and they should let you. Or y'all could talk about it, and she could tell you why you're not gonna get it. But that's it. And the second question, you said, well, with at one of my doctors, they say that we have the children, they have the right to say whether or not they want their parents in the doctor's office, and whether or not we want them to know what's going on. We have the right to do that. But me personally, I would say yes, like we should have the right to do that. But sometimes I would want my mom present.
To the first question, I was one of the people who said yes, a 16-year-old should be able to get an immunization. And I think that the age should be young, and I'm not like a professional on like developing children or anything, but I think it should be young because like if even if I'm just 16 or just 13, I should have a choice in like my body or whether I live or die by disease. Yeah. And that should be obvious.
I also said yes originally. 16, like 100% yes, you should have the option. You can drive yourself there, then you should be able to get the shot. That's what I think. But younger than that, it's like I would say I know a lot of people that like they're like 12 and it's like yes, I would trust you to be able to make the appropriate decision on what you want to do with your body, but also like is it even possible for you to get there? I don't want some stranger to come and like talk to you and be like you need to come and get your vaccination, like get my car. It's like I don't know. It's just it gets messy there because it's like how are you going to get just like logistically how is this going to work out? Who's taking you there? Like I don't know. That just makes it really fuzzy. But 16, yes, you should have the decision. I'm 16. I probably sound biased, but you know.
And then time alone with your physician.
I also think it should be an option, but once again, I don't know exactly how that would work because if you're going through and they're like, "Do you want to have a moment like away from your parents?" Like your parents gonna like death stare you, like,
Yeah.
"What do you
then
want
they'll
to say
know.
when I'm not
Right.
there?" So it's like I don't really know how that would work out either, but ideally, yes, I think you should be able to have the decision on whether or not you want your parent present.
For your first question, I'd say once they enter high school would be an appropriate age, in my opinion. And for your second question, I'd say it all depends on each individual. Like if you want to have like a time like a conversation with your physician alone without your parents, then yeah, you can just tell like ask your doctor, yo, I need to talk to you about this or talk to you about that. Can my mom like step out for a bit? And yeah.
Captain Wilkins. Oh, the comment. No, go ahead. I'm sorry.
Okay. As for the first question, I was still in the middle, but as far as like in life or death situations, 16 is enough. I know a lot of people, 16, and I know a lot of mature people. And even in that case, especially in that case where people are literally dying from something, they should be able to say, yeah, I need that because I don't want to die because that's just you want to live. I mean, I understand people don't trust people don't trust the government.
Right.
That's just honest.
Exactly.
And like, but you see people around you are literally dying from something, and you want to go home and put mud on it. Come on, man. Um, I understand the I understand the logic, but still, don't. That's you putting your child life on the line. So 16, yeah, a little younger than that. In a country like America, probably not. But it's subject to circumstance. But as for the second question, yeah, yes, ma'am. I do believe that the a patient should a child should have time alone with their doctor if they have questions about stuff because we can't talk to our parents about certain things. Um, I don't. Yeah, I'm not even gonna tell no tale. I don't like to talk to my folks, my mom and my dad about stuff because I know how they are, and I know that they still, they want to hold you tight because
You're their baby.
you they baby.
Right.
But I talk to my grandparents about stuff because I'm really really close to my grandparents. I talk to my grandparents and my auntie Matt because we're just really close knit people. We're really tight. We talk to each other about everything, and that's just me. Everybody don't have that. So being able to talk to your doctor about something that you feel is important, that's important to you, that's paramount to your health, then go for it. That should be an option. That should be allowed. So that's my spiel.
Captain.
At this stage in your life or your age group, what impact do you think social media still has on bullying?
Social media and bullying. Um, I'm considered a weird kid. So like as far as like being on social media, I share my anime memes and my band geek posts and stuff like that. But nobody ever tried to come at me about it. because I'm a pretty solid guy. So like nobody tried to pick on me, nobody tried to mess with me. Not since middle school. I'm not gonna get into middle school, but nobody nobody bothers me about it. I have seen it, and when I see it, I step in, but I don't I don't see it a lot. I definitely don't see it a lot because it's just being being a menace to somebody else because of what they like to do on social media because of what they share. It's not I'm gonna go ahead and say it's not cool no more. But people used to think bullying was cool, and honestly, it's not no more. Nobody glorifies being standing in somebody's way, being a menace to somebody else. Nobody glorifies it anymore. So it's like you gonna leave the dude alone, or we gonna handle you. That's how it is at Booker T. Washington High School. We gonna handle somebody. So like that's just how it is. And yeah, social media, it contributes, but not as much as it used to. That's to answer your question. Handle it, bro.
Social media exacerbates bullying, in my experience. And it used to be that you could go home from school and for it to not be there anymore, like home could be your safe place, but now like social media and your phone follows you everywhere. So if you have an online presence, it's everywhere, and like bullying is constant. And I think it can also be a weapon used by in intimate partner violence situations. Not to get off topic, but yeah, that's like a method of control that people use nowadays against their partners, by stealing their passwords or just constantly messaging them.
Question? Yes, yes, sir.
I'm Malachi Thomas, a sophomore from Tuskegee University, and my question is about substance abuse. So you talked about how it's normalized, and I agree. How do you think we got to that point to where it's just accepted by everybody? It's just a normal thing, and how do you think we can take a step back and undo some of that?
Okay, I feel like we got to that point. Like I said, pop culture. I hate saying pop culture. It sounds so, but pop culture is like it casts the light on it so much. And once somebody sees something so much, it doesn't even have to be in a positive light. Once you see something so much, it becomes a habit. A habit becomes a ritual, and now everybody's doing it. So maybe I should try it. But as far as remedying that, as far as providing a solution for it, that'll only come with time. Once you see, if we started showing the negative things that come with substance abuse more so than we show how it makes somebody feel, yeah, you smoke, you're gonna feel like you're in the cloud. You're gonna feel cool, calm, relaxed, hungry, take a nap probably. But what happens when you start relying on that? What happens when it becomes such a big part of your day that you can't have a good day without smoking one? That's when it becomes a problem. That's when a hobby becomes an addiction. That's when you just what else can you do? But as far as solving that problem, that particular problem, it's a you have to normalize being within yourself. You have to normalize being able to sit with yourself for a little while and take all your problems, think about them before you turn to something else to get rid of it. Think about them. Just think about them. Like, I don't like being in my head that often either because I know how my mind get. I overthink the mess out of something. I can turn something real small into something and it's really not what it need to be. So I do things. I have hobbies. You see me moving and stuff like I can't sit still for that long. So I'm not a good artist, but I draw. I fumble around in my book. I write stuff. I read. You gotta find your niche. Find something that keeps you in the mind frame where you don't have to turn to something that's gonna hurt your body or hurt your mind. Keep your spirit clean. That's all y'all can say right there.
Any other? Yes, sir.
So,
Who are you?
Ashanti Lee Davis, first year grad student at Tuskegee University. So, what I've been hearing is that it's being said that you can't talk to your parents or to adults because you don't want to feel as though you're being judged. Do you think that some of the reason why they don't reach out is that they don't want to look different in your eyes?
You know?
Do you think that some of the reason why like adults, your parents don't reach out and try to talk to you about these things is that they also don't want to be judged by their children and look different in their children's eyes?
Well, I think it's an awkward conversation to have with your parents or to have with your child. So yeah, but I think that if parents can start having these conversations kind of earlier, like age appropriate, but earlier, and just like more over time instead of just one conversation, like this is what happens, um, just like over time, and just have it as an ongoing conversation and make sure that um, they know that you can ask questions of them.
Yeah, I think I agree with that. It's like, it's not, I don't think that it needs to be like, we're going to have a conversation about this. It's like, I think it should just be that you need to make it clear that if your child does want to have that conversation or does have questions, that you're like there when they decide to do that. Because if you go through and you like push it on to them at a time like when they're uncomfortable, then they're not going to want to talk about it anymore. They're going to want to end the conversation there. So I think that it needs to be like the adult has to open up the door and the kid has to decide to walk through it. Like, it's a two-way thing.
I believe that I do think that parents don't want to talk about certain things because they don't want to be judged by their kids. Because in watching my parents, I know that parents don't like to be asked questions that they can't answer because they don't want to tell their children the wrong thing. They don't want to be the person that puts their children in the wrong path because they don't want to hurt their kids. That's in watching my parents. That's why I turned to my grandparents because they have more experience with it, I guess. They've learned from their mistakes. They've seen what their children have done. So it's just like I know how to handle it now. So I just think that parents don't want to let their children down. That's why that's why it's like an atmosphere where I guess that's why you don't want to go to your parents for certain things because you know that your parents gonna react a certain way. And they react that way because, like I said, they don't want to be asked questions that they can't answer. And they don't want to be the person that makes their kids do something that they shouldn't do.
I'd say that it varies from parent to parent. So, I mean, it depends. Now that I think about it, like I'll be honest, I haven't had any conversation like that with my parents because I don't know. I guess the hardest part is trying to break the ice with them with that sort of conversation. Like, how do I approach it to them? Like, hey, mom, hey, dad, let's talk about this and let's talk about that. But I'd say that'd be the hardest part. But personally, for me, um, I don't want to say that my parents don't care, but I mean they have that mentality of, hey, I've raised you well for 18 years, and now it's all on you. If you want to mess up your life, that's on you. I've raised you well, and it all depends on you now.
Last burning question. Yes, ma'am.
Good morning. My name is Katul Muhammad. I am a first year clinical psychology master's. Um, I want to say you guys are brave, and I am proud of you guys. My question is, as mental health awareness rises, how likely do you think the youth are being more susceptible to using these resources?
Say that one more time.
How susceptible do you think the youth are using mental health resources nowadays?
Um, okay, mental health. All right, in the black community, mental health is stigmatized. You know how my cousin, when he was 10 years old, he was in the car with his mom, and she was killed when she log truck slammed on brakes, and his mom was killed. And about a week later, his dad was shot in a gas station in Union Springs, and he is now 26. I want to say he's now 26 or 27, and he's just recently spoke with a psychiatrist, psychologist, and the thing is, they didn't seek that help for him, and it shows now. It shows in everything that he does because he doesn't talk to them anymore. He moved to California Like right after he graduated college, he moved to California, and he hadn't been back since. Well, he came back once for his grandfather's funeral. That was last month. But he left, and we hadn't heard from him since. I'm the only, me and my cousin Broderick were the only person he talks to, because he doesn't feel comfortable talking with them because they didn't support him when he needed it. Mental health is, a lot of people don't like to acknowledge mental health as an illness. A lot of people don't like to acknowledge it as something that needs to be addressed, and that's a problem. Because when you don't, when somebody comes to you with their shoulder dislocated, you don't tell them, "Oh, you'll be all right. Go sit down." Well, my granddaddy did, but that's something else. That's something totally different. But it's just, you need to, and it's something that needs to be addressed. And it's not, there aren't enough resources in a lot of communities, because a lot of people sees it as something that's not necessary, and that's just not the case. It's very necessary, especially now, because a lot of young people are experiencing mental they experience a lot of stuff now. A lot of people experience way too much to not have something to bring them to calm, and it shouldn't be.
I think that there's still a really big thing where people like, I think that I know more people now that acknowledge that mental health problems exist, but I think there's still a lot of blaming going on of the person experiencing it. Like, I know, especially with like the child to parent gap, it'll be like you're going through and you're doing all these things and you're like you're overloading yourself. You're doing this to yourself. Like, you're you wouldn't be feeling like this if you weren't going through and trying to like have these different ambitions, even if it's like in the best interest of the person. It's just, I feel like there's a lot going on where mental health still isn't accepted as something that just happens to you. It's something that you bring upon yourself. And so I think that that's why a lot of people are afraid to get help, because if they go and they try and have that conversation, it's like, well, what do you need to change so you don't feel this way, instead of what can we do to like help you get past this and live your best life. So I think that there's still a big adjustment that needs to happen about how we view mental health.
All right.
Okay.
No, go right. No, you got something to say. Let's go ahead and say it. Go right.
Okay. I feel like mental health is very, like, in the Black community, they think that it's uncommon. They think that you're not gonna have any problems, and if you do, you're just over exaggerating. But me personally, I feel like when I was going through what I was going through, it's like no one asked if I was okay or if I needed anything or how I was doing, or just like simple questions to see that the person cares. So I feel like I had to get through everything by myself and express everything by writing or reading or doing something different. And I had to learn that I would have to put my happiness before everyone else, before anything else. So I just feel like you have to learn from yourself with stuff like that.
Let's thank this wonderful panel. I'm gonna let Dr. LeBird do it. But she signed it. You see, I'll get it in. Standing ovation. That's something. You know, it's one thing to come to a wonderful place like CDC or like other places where everybody knows about it. But after you're gone, nobody knows you were there. And nobody knows what you've done. So I think they deserve more than just the acknowledgement of being here. And the director of the Office of Minority Health and Health Equity, Dr. LeBird, has a wonderful certificate for each one of them. And I think she ought to present it to them, and we ought to take a picture to let the world know they were here. So, Dr. LeBird, as I mentioned, you mentioned their names, they can come right on up.
Okay, and before I do that, I want to congratulate you all. I don't even know if you realize the weight of the last hour and a half and what you have represented on behalf of an entire generation in this really coveted forum. So you should be exceedingly proud. Your parents, your teachers, your all the people in your community should be somewhere going, they belong to me, because that's who is responsible for you being here today. So thank you so much. So I want to present this certificate to Jemiah McNeil. Kendarius Ivy, who Emma McDonald. Maya Martin. And Adolfo Berduo. Thank you, Adolfo. So I want to ask you, we can
Without a game? TU. Fantastic.